Abnormal Psychology BA 6th semester session 38. Today topic is autism. Autism is one of the most disabling of the pervasive developmental disorder in autistic disorder, which is often referred to as autism. Childhood autism in the prospective DSM-5 autism spectrum disorder. So in DSM-4 we used to call autism. According to DSM-5 autism spectrum disorder, it is a developmental disorder that involves a wide range of problematic behaviors, including deficits in language and perceptual and motor development defective reality testing and inability to function in social situations. Autism in infancy and childhood was first described by Kanner in the year of 1943. It affected tens of thousands of American children from all socioeconomic levels and is seemingly one of the cases estimated range between 30 to 60 people in 10,000. He reported that the rate of autism among 8 years olds is above 1 in 110. The reported increase in autism in recent years is likely due to methodological differences between studies and change in diagnostic practice and public professional awareness in recent years rather than an increase of prevalence. Autism is usually identified before a child of 30 months of age and may be suspected in early weeks of life. Diagnostic stability over the childhood years is quite high for autism. One research article reports that is a law and police in the year of 2006. Children diagnosed with autism by age 2 tend to be similar diagnosed at age 9. One study found that artistic behavior such as lack of empathy, inattention of others, and inability intimate is shown as early as 20 months. Autistic spectrum disorder begin early in life. This is involves impairment in relationship, communication, and behavior. So, autistic spectrum disorder were called pervasive developmental disorder and term so no longer used by experts. The new term evolved and a part of because autism is the best known and the most slowly researched autistic spectrum disorder is known in favor because it implies that this disorder are on continuum as a spectrum. So, in a dictionary, definitions of autism is a absorptions in one mental activity. Is grossly is undertakes the disorder is severe social disturbance. The autism character is by profound indifference of social relationship, odd and stereotype behavior, and severely impaired or non-existent communication. So here the autism is the most severe autistic spectrum disorder. Rather, share similarities with autism but may involve substantially less impairment. A criteria for autistic disorder. The first one is qualitative impairment in social interaction as manifested by at least two of the following like marked impairment in the use of multiple nonverbal behavior like eye-to-eye gaze, facial expression, body posture and gestures to regulate social interaction, failure to develop peer relationship appropriate to developmental levels, a lack of so spontaneous seeking to share enjoyment, interest, or achievement with other people by lack of showing, bringing, or pointing out an object of interest, lack of social emotional reciprocity. The second one is a qualitative impairments in communication as manifested by at least one of the following like delay in their total lack of development of spoken languages and in individuals with advocate speech mark impairment in the ability to initiate and sustain a conversation with others, stereotype and repetitive use of languages, lack of very spontaneous make believe play are social, imitative play appropriate to developmental levels. The third one is a restricted, the repetitive and stereotype pattern of behaviors, interest and activities as manifested by at least one of the following, like encompassing preoccupation with one or more stereotype and restricted patterns of interest that is abnormal either intensity or focus, apparently inflexible adherence to specific non-functional routines or ritual, stereotype and repetitive motors or mannerism, hand or finger flapping or twisting or complex whole body movement, and persistent preoccupation with part of the object. See delays of abnormal functionings in at least one of the following, like in the period age of 3 years, social interaction, languages use, social communications, symbolic or imaginative play, and disturbance is not better accounted by latest disorder or childhood disintegrative disorder. The clinical picture in autistic disorders, the children with autism show varying degree of impairments and capabilities. In this session, we will discuss some of the behavior that may be evident in autism. A cardinal and typical sign is that a child seems apart or aloof from others. Even the earliest stages, the mother often remembers such babies as never being held, never reaching out when being picked up, never smiling or looking at them while being fed, and never appearing to notice the coming and going of other people. The first one is a social deficit. Typically, children with autism do not show any need for affection or contact with anyone, and they usually do not even seem to know or care who their parents are. Several studies shown have questioned the traditional view that autistic children are emotionally flat. Some studies show that children with autism do express emotions and should not consider as lacking emotional reactions, and the characterize the seeming inability of children with autism to respond to others as a lack of social understanding, a deficit in the ability to attend to social cues from others. The child with autism is thought to have a mind blindness, an inability to take attitude to others or to see things as others do. The lack of social interaction among children with autism has been described. A behavioral observation study by Lord and Magel in the year of 1995. The youngsters with autism engaged in fewer social interactions than other children. However, this study also made by the important observation that the children with autism did not show spontaneous play. The second one is an absence of speech. Children with autism do not effectively learn by imitations. These defunctions might explain their characteristics, absence of severely limited use speech. If speech is present, it is almost never used to communicate expect in the most rudimentary fashion, such as by saying yes in answer to a question or by the use of apologia. The parrot-like repetitions of a few words, whereas the echoing of parents' verbal behavior is found a small degree in normal children as they experiment with their ability to produce articulate speech. Persistent apologia is found in about 75% autistic children. Self-stimulation. Self-stimulation is often characteristic of children with autism. It usually takes the form of such repetitive movements, head banging, spinning, and rocking, which may continue by the hours. Other bizarre repetitive behaviors are typical. Children with autism seem to actively arranging the environment in other own terms and on our effort excluded limit variety and intervention from the people. These children often show active aversion auditory stimuli. The other one is a maintaining sameness. Many children with autism become the preoccupied with the and from strong attachment to unusual objects such as rocks, lights, switches, or keys. So last one is intellectual ability. Intellectual ability is compared with the performance of other groups of children or cognitive or intellectual tasks. Children with autism often show marked impairment. Some children with autism are quite skilled and putting objects together, thus their performance on puzzles or form of board may be average or above. Even in the manipulation of object, however, difficulty to with meaning is apparent. Symptoms of autism is characterized by significant impairment in social communication skills and the display of stereotype interest and behavior. Age symptoms range from mild to severe. See, autism spectrum disorder is characterized by social impairment, like deficit in social communication, social interaction, like typically social, emotionally, respiratory is interest in social inter may be limited, totally unlocking. So, a typical non-verbal communications is there is no eye-to-eye content, absence of meaningful gesture and facial expressions, is difficulty to developing and maintaining relationship, maybe lack of interest to others or failure, and recognize people identity, their emotion, they are not able to express their emotions, their failure to seek the physical emotional response, and the next is a repetitive speech, is movement or use of object, is repetitive apparently purposefulness movement, like example head banging and arm flapping, rocking the body and spinning object, whirling in circles, etc. is a common symptom. Those with a high ASD have sometimes repetitive stop as spin object or move them from side to side, and intense focus on rituals or routines and strong resistance change is a common rituals involve the objects and same food order of event, desired routines, small changes in routine can produce an extreme distress of intense reactions. The next one is a intense fixations, like this may involve the concentration with a certain object or a repetitive focus on a narrow range of interest. So here the communication problem is ranging from few difficulties in Asperger's disorder is the high functioning of ASD that we describe shortly to profound impairment in most cases of autism. Some children with autism fail to speak to all between the age 1 to 2. That time when normal children is typically learn their first words, the other learn a few rudimentary words such as mama, and they suddenly lost their language ability. According to field studies conducted DSM-4, 54% of the patients with autism is mute as to 35 patients with ASD. So these are the information is collected from this book, Hani K. Crank, Sherry Johnson's Derlander Division in the Abnormal Psychology in the year of 2012. Butcher Woolley and Susan 2014 Abnormal Psychology. Susan Nolan, Ockman 2011 in Abnormal Psychology. And James Hansel and Lisa Damaro in the year of 2008, that is Abnormal Psychology.